Hello, we are Anna Lee and Minyoung from South Korea, and today we'll be presenting about enhancing oral health disparities.
To introduce myself, I'm Minyoung, a rising junior at Chadu International School in Korea. I lead the Chadu International Science Society, the leader and founder of Community Medical Service Organization, and Chadu International and More Club. I also participated in GHLC 22 and returned this year for GHLC 23. I have participated in medical volunteering for underrepresented communities as well. My fields of interest are biology, medicine, public health, and more.
My name is Anna Lee, and I'm a rising senior at Seoul International School. I've been a consistent member and a leader in the Medical Society Club, leading the Helping North Korean Refugees Club, Science Club, and Science National Honor Society. I've researched disparities in oral health and participated in medical volunteering for underserved communities. I'm currently interested in biology, biochemistry, public health, and dentistry.
Moving on to our topic, we'll focus on potential solutions to reducing oral health disparities. We aim to raise awareness and propose possible solutions to minimize the oral health related challenges for minorities. We also like to enhance understanding of the importance of maintaining good oral health conditions, as oral health contributes to the health of the entire body.
So, what exactly is oral health? According to the World Health Organization, oral health is a state of mouth, teeth, and orofacial structures that enables individuals to perform essential functions such as eating, breathing, and speaking. Maintaining poor oral health directly links to psychosocial aspects such as low self esteem, poor well being, fear of embarrassment, and much more.
Some of the major types of oral disease include untreated dental caries, known as tooth decay, and according to the Global Burden of Disease in 2019, this was the most common global health condition. Next, there are also periodontal disease, which usually come in the form of bleeding and swollen gums. Such diseases affect around 19% of the adult population worldwide, accounting for over a billion cases. Tooth loss is also widespread, as it has affected 7% of those aged 20 plus years and 23% of those aged 60 plus years. Finally, oral cancer is the 13th most common type of cancer in the world, and there were over 377,000 new cancer cases in 2020.
What is the connection between oral health and global health? Oral health diseases are the most common non communicable diseases, which affect more than half of the population worldwide. Numerically, 3.5 billion people are diagnosed with oral diseases, and every 3 out of 4 people in the middle income nations are impacted. Oral diseases are the most prevalent health condition in all nations. Therefore, oral health disparities is a global health problem that must be approached globally.
Importance of oral health. There is a proven relationship between oral health and general health, meaning oral health impacts the entire human body. Most oral health diseases share similar risk factors with chronic diseases like cardiovascular disease, diabetes, etc. Therefore, as we age, maintaining good oral health condition is crucial to keep up with our physical and emotional well-being.
To expand upon the association between oral health and overall health, we would like to discuss the short and long term complications of poor oral health. Some possible short term effects include dental plaque, bad breath, food poisoning, gastroenteritis, reduced immune resistance to germs, endocarditis, and pneumonia. As you can see in the photo, dental plaque is a substance that is made from leftover food particles and saliva in your mouth. Hence, if you don't brush your teeth regularly, then it builds up on your teeth, causing cavities.
Some possible long-term effects include risk of oral inflammation and infection, tooth decay and cavity, social and psychological difficulties, risk of heart disease, diabetes, pregnancy complications, HIV/AIDS, osteoporosis, and Alzheimer's disease. To elaborate, oral conditions and chronic diseases are interrelated. For example, if you have a gum disease, the bacteria from your mouth can enter your bloodstream and cause infection in your heart valves. In addition, gingivitis, which is a type of gum disease, shows a connection to a higher risk of being diagnosed with Alzheimer's disease, as the enzyme called gingipane released from gingivitis was detected in the brains of people with Alzheimer's.
With this background information in mind, what are oral health disparities? Oral healthcare disparities are the unequal opportunity to be healthy in terms of one's oral health. This type of disparity is often associated with their backgrounds, the groups they partake in, and much more. For example, economic status, ethnicity, age, gender, and job status can all factor in oral health disparities.
Expanding upon oral health disparities, we would like to provide quick stats regarding the current situation. Oral health disparities can easily be seen among different ethnic groups. For example, regarding the rate of children visiting the dentist, 34% of Black children visited the dentist, while 50% of white children visited the dentist in 2009. And regarding the tooth decay rate, while only 17% of Asian adults and 22% of white adults had untreated tooth decay, 42% of Black and 36% of Hispanic adults had untreated tooth decay between 2011 and 2012. Hence, a clear association exists between visiting the dentist and tooth decay.
If oral health disparity is a global health problem, what are some solutions necessary to solve this health issue? First of all, education is pivotal. One major issue in the underserved population is a lack of primary education in oral health and trained professionals to educate the people. This situation causes poor oral health for minorities, hence, improving oral health literacy, such as toothbrushing with supervision, educating the importance of good oral health conditions, and promoting comprehensive oral health in school settings will be necessary. Some of the quickest changes caused by improved education will be a significant reduction in children with cavities, improved oral health hygiene, and awareness of self-management skills.
Another possible solution can be to tackle government-sponsored policies toward oral health. According to Patrick et al., research and development in the relatively small dental industrial sectors worldwide is very limited. Even major multinational companies based in the US invest little money in developing new preventive technologies to help alleviate oral health disparities. Therefore, policymakers should consider devoting more funds to research and technological development in the oral health industry. Another possible option is to expand the National Health Service Corporation's funding, as researchers at Harvard University School of Public Health found that expanding NHSC financing by 5% to 30% reduced dental caries.
The last possible solution is to enhance oral health disparities through intervention programs. According to Cambridge Dictionary, an intervention program is to become involved in a difficult situation or to improve or prevent it from worsening. Likewise, developing countries need help from outside organizations or governments. Intervention programs for these countries should focus on primary care and prevention of oral health diseases. For instance, an intervention program can include reducing disparities for tooth decay, developing basic dental infrastructure in rural areas, and increasing collaboration between medical and dental healthcare. Additionally, community-based preventive programs such as water fluoridation is a method to tackle the global health issue of oral health disparities.
In conclusion, to summarize the key takeaways, oral health disparities are present worldwide, affecting over half of the world's population. Therefore, it is crucial to improve oral health literacy among underserved populations. Some possible ways to directly contribute to society are to get involved within the local community, volunteer at local clinics for the underserved community, and educate young children on proper oral hygiene. Finally, governments should devote more funds to research the dental industry and expand the dental workforce. Thank you.
Thank you.